Hi, I'm Lori Herman, and I have a natural brand of skincare products that I formulate here in Newport Beach, California, and I also do a lot with nutrition and well-being. I'm here today with the great Heather Ritchie, physical therapist in Corona Del Mar Physical Therapy in California, and I found her because I had a issue with my arm. I went to my doctor and she said, you need to go to physical therapy. I didn't really know what physical therapy was, so I wanted to bring one of our influencers to you today so that she could tell you a little bit and share what she does here in Corona Del Mar to help people get better. And my daughter had an injury with her wrist. I'm like, I've been having this arm issue. I think I need to go and get it addressed. So I went to my doctor, like I said, and I had said I had the issue for maybe 6 months to a year. I really think now that I had it for a couple of years. It was just lingering pain. After coming to Heather one time, I swear it was 50% better, and she just worked her magic, and I'd love for her to share a little bit about what she does.
Yeah, I'm Heather. I'm the clinical director at Corona Del Mar Physical Therapy. I've been a therapist now since 2004, so coming up on 14 years now. We're in 2018. I've been in the private practice setting my entire career, so I'm very confident and comfortable with a variety of orthopedic issues. I've been doing it my whole physical therapy career, and I'm so happy to meet Lori and have both of us kind of share her story a little bit about what was going on with her and how physical therapy can help other people similar to Lori.
Well, and what I was sharing with her is I didn't realize that it wasn't for people that had an injury, surgery, or a car accident or something. And so I was talking to her earlier and just asking, how many people, what types of people come to you?
Right. So a lot of people think that for physical therapy, it's post-surgical, you've had some sort of injury, some sort of obvious trauma, some sort of obvious fall or accident. But a lot of times physical therapy is more just for general aches and pains that just linger in the case of your shoulder, pains that just don't go away, and they can't sort of figure out where is this pain coming from? Why did this pain start in the first place? And another thing that we were talking about is that over time, people just start to kind of live with it. They start to kind of just accept that this is a part of who they are, and it starts to affect their quality of life. It starts to affect their social activities, how they interact with family members or coworkers or friends, because they start to shy away from that. So physical therapy is more than just obvious aches, surgeries or injuries, but it can just be for regular lingering pains that just don't go away, such as the case with Lori. One of the cases that I had recently with a particular patient was he was working at his job, and for the last year or so he had this neck pain, and this neck pain was always present and never seemed to go away. And he would try stretching, he would try going to the gym, he would try chiropractor, try medicines, try whatever, and never really took care of the problem. And so when I was interviewing him or evaluating him, I was asking, well, do you have any neck surgeries? Do you have any history? No. So in the absence of any obvious trauma or any obvious factor causing the aches and pains, one of the things you want to look at is something like posture or ergonomics. And in the case of this guy, he was sitting at his desk with his monitor off to the side and his keyboard over here. And he didn't realize that repetitive looking off to the side and all day, 8 hours a day, 10 hours a day, 6, 8, 12 months or whatever. So as soon as we moved his monitor in front of him, his neck pain went away. And so it was, he didn't really have anything wrong with his neck. There was nothing physically, structurally wrong. All x-rays were coming back negative, but it was just his ergonomics and his posture, how he was holding himself. That's what made the difference once we changed it.
And so when you're describing that too, what are some other things that you would like people to know about physical therapy that you do here?
So, as Lori was saying before, we deal with just aches and pains that just don't seem to go away, seem to linger. And in the case of Lori's shoulder, it was something simple as one muscle group was a little bit tight, whereas another muscle group wasn't as strong. So we're restoring that muscle balance to allow that shoulder joint or whatever joint we're dealing with to function a little more properly. She can still lift and carry and move and exercise, but it hurt
all day. And I didn't realize it was seriously, and that's why, to be totally honest, it was probably like a couple of years. Right. And I was always lifting tables for my business. And I think that just over the time, but honestly, I think we were just talking that I came in 4 to 6 times maybe. She gave me exercises, so I'd be doing my exercises, my physical therapy at the gym sometimes, and people are going, what are you doing? But I really wanted to see, and it was honest, I didn't even come for 2 months.
Yeah, it was a very short period of time.
Short period of time, and to be and having that pain where I came in and I'm like, oh, I lifted my hand above my head last night in bed, just laying down. And normally I would have kind of felt it. So I was so happy. And then my daughter, her leg collapsed on her in September, I think it was. And I was so happy that I knew exactly who to bring her to when we got the report from the doctor that we needed to go to physical therapy. And my girlfriend just had a hip replacement, and I brought her and sent her down to Heather. And I'm just so grateful that we have her so close, and she can fix us all up. And that's where we want to be, as healthy in 2018.
Right. Absolutely. And then another thing that a good physical therapist can help with is not only ergonomics at someone's desk, but how they're holding themselves when they're driving, the posture that they're sleeping in. Sometimes it's something just as little as changing a pillow or adding a little rolled up towel to the small of their back when they're driving. Especially people who, if they sit a lot for their work or they drive a lot for their work, they're driving to and from LA, they develop this low back pain that just kind of just nags and lingers, and they'll go to their doctor and the doctor's like, well, the x-rays are negative and I don't know what's wrong with you, so here's a whole bunch of medicine you can take. And if it's something that's just as simple as, changing your posture, adding a couple of stretches to address any areas of tightness, that sometimes is all you need, and it can be a kind of a quick fix. Hopefully.
Well, and that's the thing I think that people don't realize, and that's why I wanted to bring her out today to talk to you guys, because I don't think people really know about physical therapy, and it can really help and take away the pain, and we shouldn't be living with pain. So.
Yeah, agreed. And a good physical therapist should do a pretty comprehensive evaluation. So in the case of Lori, not only am I looking at her shoulder, but I'm looking at her neck and her mid-back or her thoracic spine. I'm looking at her posture. I'm looking at, if you tell somebody I'm going to look at your posture, they're going to sit up straight.
But I'm trying to sit up right now.
But if you just kind of have a conversation with them and you sort of see how they sort of start to slouch, or in the case of a hip issue, you'll see them kind of sit off to one side or sit off to the other side, and then you kind of look, you're like, do you normally put all your weight on your left hip when you're sitting? And they kind of,
it's habits.
Yeah, it's habits. It's repetitive stress. It's things that you're not even realizing you're doing. So a good therapist will look at a bunch of different body parts or a bunch of different factors that potentially could be involved in the painful area.
I think you were telling me with that guy about the neck issue at work is you didn't get down to until like kind of the final couple minutes of talking. You're like, wait, what? Your monitor's over here? Like,
right. Because the sort
we're
of
not meant to do that.
The natural tendency is you sort of ask the person, well, have you had any surgeries to your neck? Have you had a history of neck issues? Has the doctor taken an X-ray? What does the X-ray show? And someone's like, no, I have no neck history. I have no neck surgery. The X-rays came back negative. He put me on this medication. That doesn't seem to help. Well, the medication's not going to help if his monitor is continuously over on the wrong side of the room. So, it's not like it comes to people right away, like, aha, here's the problem.
It doesn't.
But it takes a little bit of kind of figuring out, like, how are you holding yourself? How are you working out? How are you working? How are you sleeping?
Yeah.
And that can make the difference.
Well, I love it. Is there anything else you want people to know about today?
No, if you have any questions about any of your body parts that are giving you an issue,
if you're local in Orange County, please do.
Give me a call.
She's awesome.
I love my job, and I love helping people and making a difference with someone like Lori. That's honestly what it's all about.
My arm's totally fine. All right, you guys, thanks for watching.
Thank you. Bye.